I'm Harinder Dhanota, and I'm an orthopedic surgeon here to talk about lift surgeon marketing assistance that OrthoAlign offers. A little bit about myself. I was born and raised here in the community where I practice. And after I went away for medical school residency and fellowship, I came back to the community. Um, my practice is this kind of smaller rural town. The town itself is probably about 60,000 with a whole service area of 100,000. And I've been in practice here for about 3 years, mostly doing general orthopedics. And I had a desire to ramp up total joint volume after I started, and had been utilizing OrthoLine already about 2 years when I kind of reached out through my OrthoLine rep about different opportunities to market myself. And the discussion really came from, in our institution, a lack of support for marketing through the hospital system and through the medical group system that I'm a part of. They have a lot of strict criteria about not being able to market individual surgeons, and they're able to market the whole group, but that wasn't really helping me in my situation starting off and just being new here and having some partners that had been well established who didn't really need it. And so I started to do some research on my own to see what the options were that were affordable and kind of gave me the opportunity to market myself and try and increase my total joint volume. And that's kind of how my experience with lift started. Um, Before we get into the lift marketing, for those of you that aren't familiar with OrthoLine, it's a simple handheld device that's used on a sterile field that allows you to establish your positioning of your components and anatomy before doing your implants and your cuts, which is great. And in my situation, the part I liked about it is there's no CT scans needed. There's no big computer in the operating room when you're utilizing it. It's a small handheld device that is very accurate and it enables you to accomplish anything you'd want to do with the full older style navigation system. Um, and with more and more insurances denying CT scans for preoperative planning for joint replacement surgery, I thought it was a great option and really a great marketing tool as well to offer something my patients in the community what they haven't had in the past when we're leaving the community to obtain it. How it works is it has proprietary algorithms with the accelerometers and gyroscopes built into the device, kind of like your iPhone is, and that communicates with a wireless sensor on the device itself that it helps you register the patient's anatomy to be able to fine tune and put in your components based on that patient's anatomy, just how computer navigation traditionally works, but in a lot smaller device and not requiring any CT scan planning ahead of time. It's compatible with any joint system, so you don't need to use any specific type of implant, which is nice because you're free to kind of work with whatever implants you're used to working with. And in my situation, I found that very beneficial and an easy transition to incorporate this into my surgical steps. Um, OrthoLine offers the lift program to the surgeons that use OrthoLine as a no-charge thing, and I think that's awesome. Their whole goal is to establish a relationship with their surgeons and offer this marketing tool for people basically in the same exact situation I found myself in. And I've been really pleased with the relationship I've had with OrthoLine and the lift team there since I started communicating with them several months ago. So from the date I first contacted Lyft, things moved pretty quick. They got a well organized team over there and individuals that will contact you and get all the information that they need. From the date I contacted them until the presentation, and it was probably delayed more so from my standpoint, getting some things together, but it was probably about 2 month turnaround, and that's really just to give them about their 4 to 6 weeks of marketing time that they request to be able to get the information out there to the community. Most of the communication was done via emails and phone calls. To myself, it required very little time. I was able to give them what I thought my community needs were, what my expectations were from them, and they were able to work with that information and come up with a marketing plan that they had back to me within a week. And we were able to make small changes to that as we went along. um, and it actually worked out very well. I was hesitant at first to kind of proceed. When I talked with the Lyft marketing team, um, they were really into the whole social media and electronic advertising, which I thought in my community would not have a great effect. Reason being, the rural community I'm in, I thought that we would have a better response with print ads, flyers, billboards, things along those lines. Uh, I was able to do some kind of own social media marketing on my own, and I thought at that time that the feedback was very minimal, and that was kind of why I was hesitant. Not to mention sometimes the cost and the work that goes into doing this yourself as a busy surgeon sometimes make it very difficult to be able to incorporate this into your busy life already. Um, After speaking with the Lyft team, I still told them my concerns, how I preferred print ads and direct mail and newspaper, and we came up with a plan, and they allowed us to alter it that way, and we did some newspaper ads, and we did the social media ads, and um, they were right. The social media and the electronic ads were able to give us a lot more feedback and clicks, and the majority of the people that actually ended up signing up for the presentation were signing up through the social media ads. And the good thing about the Lyft, the marketing, is they can trace back where the patients came from. So the information that was provided in the newspaper was a different link than the information provided online. Therefore, we knew where we were getting most of our patient interest from, and it did correlate mostly to Facebook ads and the social media ads. So the marketing involved 4 weeks of marketing, mostly digital. We did do some local newspaper ads and community flyers that we handed out. The Lyft team was really good at giving me weekly updates. Um, they told me ahead of time, really, with especially with these type of talks, we don't garner an interest until about 2 weeks before the presentation, which I was skeptical. I thought we would have some patients lined up before that, but at that 4 week mark, we really had a few clicks. We had a lot of clicks, but not a lot of people that signed up. Um, However, around that 2 week mark from the date of the presentation, we saw an increase in the amount of clicks and the people actually signing up. So their experience definitely helps, knowing, having done this before in other communities, kind of what to expect. And it did ease some of my anxiety about concerns when I didn't see a lot of clicks or a lot of interest garnered in it. And so that does help having a good experienced team doing this for you, where we're orthopedic surgeons. We like to spend our time with patient care and surgery, and so it's nice to be able to offload this to someone that actually knows what they're doing with social media and marketing. Um, like I mentioned, most of the marketing came via mostly click ads. The cost, we kind of established a budget, was about $3,500 to $4,000. We ended up spending about $3,700. That included the cost for the social media, the print ads, the flyers, the venue where we ended up doing the presentation, light refreshments and appetizers for the people that showed up. Um, so overall, the cost was I thought very acceptable, and Lyft is able to help. They do have some restrictions from industry guidelines and government guidelines about how much they can help financially of this part. But from what I understand, it's about 50%. So 50% of that cost is actually picked up through Lyft and through OrthoLine. Out of the 38 attendees that came to the presentation, 17 ended up signing up to want to be contacted. I actually had my medical assistant there with me at the meeting. She was nice enough to come on her time off to be able to coordinate that, but she took all the names and information down, and then was able to contact these patients the following week. And a lot of the patients contacted my office on their own. Out of the 17 that wanted to be signed up or had shown interest, 6 actually showed up for an appointment within the next 2 weeks. And out of those, it yielded two total joints. Both were total knees, which I thought was a pretty good generator of total joints out of 38. That's pretty good. Not to mention the indirect referrals and the marketing and the name that you get out in the community just from people that see the ads and aren't able to come to the meeting, but maybe saw me a month or two later and did mention that they saw that and they wish they could have made it, but they were unable to. Um, as far as the cost, for those that may be skeptical about the cost and paying this and what's the return on investment, if you start looking into doing social media advertising and marketing, the costs add up pretty quick. $3,700 I thought was pretty reasonable. If you can yield 2 total joints out of, say, $4,000 cost, going by Medicare, which is pretty standardized around the U.S., it's about $1,400 for the through the CPT code that the surgeon gets. So if you're able to accumulate 3 total joints, you've actually already made up for your cost, and it's probably even less if you're able to split the cost of this marketing 50-50 with Lyft. And private insurance varies from area to area and contracts with medical groups, but up to 5,500 for a total joint under private insurance, and that's one surgery, and you've kind of paid for it, and then after that, everything that comes in is extra. So I think the return on investment is definitely worth it. It does not take a lot to get your return, and in addition to that, if you're able to bill for the computer navigation code, which is CPT 20985. That's an extra 2.5 work RVUs, or in my facility, how it translates to approximately $529. Now that's going to vary from what actually the insurance companies may pay and which insurance companies are going to pay it, but it's something to keep in mind, especially if you're on an RVU based value only anyways, to get extra RVUs to add on to your case. So like I mentioned, there's a lot of members in the community that definitely were aware, wanted to come to the presentation, but were not unable to. And they mentioned that when they did see me a couple months later out in the community when I was walking around. I live in the community where I work. I love my area, I love my community. I was born and raised here, and so I see run into patients, good or bad, at the grocery store and at the restaurants all the time. And I did have an uptick of people approaching me saying, "Hey, I saw your picture on Facebook or in the newspaper. I really wish I would have came to the meeting. How do I get into your office to see you?" All the feedback was positive. And for those people looking to kind of ramp up their practice, or if they're new to an area or new to their practice and they're trying to build a brand and build market awareness, I think the Lyft is perfect for that. And OrthoLine was embraced by all the attendees. They appreciated the technology. I think patients nowadays are very in tune with what they want, what they need. Everything's at the click of a button, so they like to research things. They're all looking for the best way that they can get their joint replaced and have the best outcome. And they liked the idea and understood the idea of being able to navigate their specific anatomy and put in components well balanced and well positioned will increase the longevity of the implant and also the range of motion post-operatively. So the patients, no matter if you're in a rural community or in Silicon Valley, they're going to appreciate this technology and it's going to draw them to you. That's about all I have. I appreciate you guys listening. If you have any questions, you can reach me through ViewMedi, and thank you very much.